friend.
We're officially on air. Literally, there's air.
Yay.
I'm very, very excited that I finally get to interview you. I know this is something that we talked about in an Uber when we were in Monterrey, Mexico.
Like all good things.
Like all good things.
Yeah.
That was a great conversation.
That was a great conference.
Yes, we had a lot of fun. Actually, you and I met at the Mexican Academy, right?
Mm-hmm.
This year in March. Oh my God, qué
Yeah.
rápido pasó el tiempo. And I remember we went to a power chair. ¿Cómo se
Like
dice?
soccer.
Team. Yes, game.
Yeah, football. Power chair football.
Ajá, exacto. And it was at the time that I was struggling walking around, so I was like, okay, I need to hang on to someone or something at one point. So I saw you wearing this beautiful yellow dress, and I was like, that's it.
Perfect.
I got to hang on to her. So I remember I approached
Nobody's
you.
going to run into us with this like bright yellow dress,
Yeah,
right?
Exactly. We're gonna.
We
be
will
seen
not. We're gonna get
because
seen.
in Monterrey there's no sidewalks, as you saw.
Yes.
So I grabbed onto you, and I did not let go of you for the entire night, and I'm so glad I did. If there is something that I'm grateful about having CP is that, besides falling down and losing my balance, is that I get to meet amazing people like you all the time who I'm allowed to grab onto, and just meeting you, you're like bright and happy, and I was like, okay, this is a beautiful human, and yellow is my favorite color. Why not?
Aww.
So thank
Same,
you, my friend.
Azucena. What an
Thank
honor
you.
to be here, and what an honor to have met you and to be on this like podcast with you. I'm so excited.
Thank you, my friend. It truly means a lot. You are someone I deeply admire. Because you shared a lot of personal things in that trip. But we're going to start the interview. But before I start with questions about dystonia, because you are presenting at the American Academy for CP, I think it's educational session 61, I believe, advances on dystonia. And well, one of them, I think you're presenting on several different topics, but the one we're going to chat about is on advances on dystonia. I want to ask you a couple questions that have nothing to do with, your job, your day job, because I feel like all the time as doctors, you're very much into your careers and your roles, and patients don't get to meet their doctors as just people.
Sure.
So, I have 3 questions for you. So the first one.
I'm nervous. Okay.
So the first one, if you can have one of these 3 superpowers, which one would it be? Knowing all the languages of the world.
Oh, that's a great one. Okay.
Being invisible.
Uh-huh.
Or, what was the third one I had in mind? Or time traveling.
Oh, forwards and backwards.
So knowing all the languages of the world, invisibility, or being able to time travel. Which one would you pick? And why?
I think if I could, as long as I could time travel forwards and backwards, I would say time travel.
Okay. Why?
Because I am an impatient girl, and I want to see, I would love to see if what I'm doing now, what impact that has on the future. And if that's the desired impact, and if not, I'll come back and change something. So I'd run like little time experiments until we get the impact that we need.
Wow.
Yeah, but I'd have to go forward and back. Can't just be one way. I'd have to be able to go back and forth. So that's critical.
Okay,
Yeah.
Good to know. That's kind of intense, though. That means that you sort of live in sort of the anxiety of not knowing on a day-to-day basis, knowing whether your job, right?
Yeah, I think we all do, though, right? Like, I think we're all focused on, I think, sorry, we're not supposed to be talking about work right now, but I think part of what my job is as a physician who cares for primarily children with CP is, I feel like, and also as a mom, like I'm trying to get through the day. Like I'm trying to get to bedtime. Like I'm trying to get my kids in bed and like have a glass of wine, like that's my goal for 24 hours. And I think for the families I see in my clinic, sometimes it's like, let's just get through this doctor's appointment. Let's just get through this meeting to set therapies at my kid's school. But a lot of what we're doing for our kids is so they'll stay healthy for their whole lives. And sometimes, I think a lot of the time, families that I see in my clinic, and I run a cerebral palsy center at St. Louis Children's Hospital, I think our families, sometimes I'm the first person that said, your kid's gonna grow up, you know? Like, I'm the first person that said, like, this is gonna help, that said anything about college, or that said anything about when they're 40, what's the plan? And I'm very much aware that as a mom, I take that's a privilege I have. I take that for granted with my kids. And I don't know how many families have been granted that privilege by medical professionals to say that your child will grow up. And so, like, I think about that a lot. I think about, like, okay, well, we don't quite know about, like, what I'm doing for a child who's 3, like, what does that mean when they're 45? And so I want to time travel, man. Like, I want to figure it out.
That is a very deep response. I'm so glad you said that and you shared that. Totally not where I was thinking of going, but
also it's cool, right? Time travel's cool.
But it's very interesting because I just had we just saw him and he might hear this. Earlier today I had this conversation with Nathan Rosenberg and David Fromberg, who's literally outside.
Fun.
And I was saying how when you give any sort of let's say a surgery, you know, I've had many surgeries, you're looking at the child. How is that going to help the child with their mobility? But I was telling them, like, I feel like in my case, they always saw me as a kid and they never thought thought what kind of impact are these surgeries going to have on her as a person, as a woman? Yeah. Not talking about mobility.
Yeah.
As a woman growing up with, you know, so many scars.
Yes.
Right?
Yeah.
And as an adult. So it made me think just about that.
Yeah.
Thank you for sharing that and being so deep in your response. I really appreciate that. And these are things that I'm sure, you know, people don't hear very often. The second is, I know you like to cook.
I do.
Because when we chatted in Mexico, you went to these amazing restaurants, and you said, you know, I like to cook. I remember you telling me.
I like eating more than I like cooking, but I like both.
Okay. What is your signature dish? What would you say, like, okay, this is a dish that I give to people who come to my house for the first time that I want to impress?
Oh, that I want to impress?
Yeah.
Ooh, okay. What do I do that I want to impress? You know what I did recently that I don't know that this is a signature dish because I'm very, I would say, restless. I don't repeat things very often.
Yeah.
But I made this potato gnocchi with peas and like a pea puree and fresh corn. It was really good. It was really beautiful. And so I like did my little like Instagram picture.
Muy bien.
So that I think that looked very impressive. And I will say the biggest like sort of badge of honor there is sometimes I make stuff that I think tastes good or looks impressive, but my kids won't eat it. And my kids ate it, so I feel like it looked good and my kids ate it. So that was a winning dish.
Would that be a dish that you would give to me whenever I visit you to St. Louis? Muy bien.
Let's do it. You need to come now.
Okay, yes.
Yeah.
I'm going to ask for that dish.
Perfect.
Okay, keep it in mind. And then the third one is related to children. Do your kids know your job? Do they know what mommy does?
Yeah, that's such a great question. I think so. But I don't think I think they each take different parts of it, internalize different parts of it. So I have 7-year-old twins and a 5-year-old girl, 7-year-old twin boys and a 5-year-old girl. One of my twins this year came to our Cerebral Palsy Family Day. And I thought I had to prep him in some way. Like, you're going to see a lot of people in wheelchairs. You're going to see a lot of people using walkers to walk. You're going to see some people that use communication devices. And what so, I mean, he was there, he saw us run the event, and he like played with all of these kids. I think when I told him all of this, he was like, yeah, I know. I don't think there was no sense of, it was just a part of life.
Surprise.
Yeah, there was no surprise. I don't know if that's because like they hear me talk about this stuff at home, or they know what I do, or I mean, I'm sure they've heard cerebral palsy more than any other 7-year-old has, or most 7-year-olds have heard cerebral palsy. But that was really heartening to me that I didn't have to prep him at all. He could have walked in there and it's, I'm playing with kids. So I thought that was cool. Then my other son loves giving me jokes. He says that when I do a talk that I really need more jokes. So he likes going through slides with me and giving me a joke for a talk. So that's my other little boy, Singham. The first one was Neil. And Andal, my youngest, she loves the concept that I have a lab. And so, and that I do research. So she calls her bedroom her lab, because that's where she does her work. And there's a video of her from when she was, I think, 3, where she has like a grocery, like just a paper bag on her shoulder. And my husband's filming her and he's like, where are you going, Andal? And she was like, to my lab. And he was like, what are you going to do there? And she was like, write emails and eat snacks.
That is what mommy does.
Yeah, that's what I do. So they have little, they've internalized little bits of it, I think.
Oh,
yeah.
That is amazing.
Yeah.
And what if one day one of these beautiful children say, Mommy, I want to do what you do?
Yeah. I think that would be great. I think that would be, I'm trying to be very careful as a parent to not, push them into, I don't want to mold them into me, right? I want them to be themselves. But yeah, that would be wonderful. I think I'd learn a lot from them.
You would have two people in the same household with 2 labs. Well,
Yeah.
you already do. Two labs.
That's right. I already do have 2. That's right. There's already a lab running. We have a collaborator.
And talking about, what you do, obviously you are very well known within the field, and
I'm very loud. Yes.
And if people want to know your resume, they can go online. You just are very impressive. But as I was saying off the air, there's this little challenge that I have for you is I want you to describe dystonia for both of my audiences. Actually, 3. I have 3. Not recently. My birthday was in April.
Oh.
And
Happy belated.
Thank you, my dear. And I know your birthday was January 16th.
15th. Very close. Oh my gosh.
Very good. Yeah. I know. Sometimes I freak out. I'm like, why do I remember?
Wow.
So anyway, this little boy who listens to the podcast with his mom, 4 years old, sang happy birthday to me.
Oh.
And it was he has CP, very sweet. So I have little ones, right, that listen to the podcast. I have parents of little ones and siblings too. But also I have a lot of physicians from Latin America that listen to the podcast. And actually that's one of the reasons why I'm also super excited that I get to interview you, is because I wanted to interview you regardless. But then when I when I met with like 6 different doctors from Latin America and say, hey, help me pick which sessions you would like me to go to, and I'll interview the people and just send me your questions. So your session was like the top.
Awesome.
So I want you to describe what is dystonia to these 3 audiences, where the 3 of them can understand what dystonia is.
Totally. So I, across all audiences, this is how I describe it. And there are consensus definitions. There are groups of people that get together and talk about, the specific medical wording for dystonia. But at least when I think about it, I think that it's every time a person tries to move or someone else tries to move them, that a part of their body they did not want to move moves out of their control.
Okay.
So it's this concept of there's a trigger. So whenever you try to move or someone tries to move you, so these things that can trigger these movements to happen, and they happen in parts of your body that you didn't, like that part of your body had no business being involved in that movement, right? Okay. But then there it goes. So I think particularly in CP, if those words, if you feel like those words describe some of your movements, it's very possible that dystonia is something that you have.
Okay.
Yeah.
And these movements, can they happen in any part of the body? Like, I don't know, in your neck, or I don't know.
Yeah, they can happen in any part of your body: face, neck, trunk, arms, legs, feet, hands, fingers, any part of your body. There's also a type of dystonia that affects your speech, that affects your vocal cords too. So really any part of your body can be affected.
And is it always like, because you're going to talk in your session about, in your educational session, about the sort of the barriers to diagnosing it, right?
That's right.
What are those barriers? Because I would imagine it's pretty evident maybe if someone is doing certain movements that were not intended to do or didn't want to do. And obviously I'm not a physician, so maybe I'm talking crazy here.
No.
But what are those barriers to diagnosing dystonia?
Yeah, so great question. There are a couple different ones. One is that a big trigger for dystonia can be stress, like being really stressed out. And so if a physician comes in and one of the first interactions they have with you is having someone pick you up and put you on the exam table, you're being handled already. You're stressed out because it's a medical environment. This is not, it's not a rainbows and unicorns type situation. It's a stressful environment for a lot of people. I think particularly for children, but also for adults, it can be stressful. And so it's possible that as a clinician, you don't really get to see anything get triggered because someone is dystonic the whole time. Like those movements are happening the whole time because they're stressed the whole time, or you only start paying attention to their movements after you pick them up and put them on the table, so you've already handled them. So it's hard to then differentiate dystonia from any sort of tightness they might have, like spasticity that's there all the time.
Vale.
So that can be really difficult in a clinic visit.
Okay.
I think clinic visits are short. There's 30 minutes often for a follow-up, sometimes less. Mm-hmm. There's a lot of stuff to get through. Mm-hmm. I know in my clinics we have to cover everything in that period of time, and maybe there are other kids in the room. Mm-hmm. Those kids are running around. The caregiver's attention is distracted. They're trying to get out of there to their next appointment. So unless you're really tuned in to say, like, have I made sure to check for dystonia in this visit, it's easy to let that pass. It's easy to let that fall away. And then the last thing is, we don't educate each other or the community enough on dystonia. I think the number of families that know, I think if you were to tell, I will ask our families, okay, so this person looks really tight to me right now, or you look really tight to me right now. Are there times when you feel really like loose and floppy? Or your legs are like really stiff and sticking out and crossing right now, but are there times when like they're not like that? Because I may only see them in their most dystonic moment. I may not see what it looks like when they're not dystonic in that short period of time. And so I ask families and people with CP to tell that to me, but I don't know that's not as routine as I would like it to be. And I also don't think people with CP and caregivers know to look for it in that way at home.
And there's two things here. How do the caregivers usually describe dystonia, if there is a description? Because I know that's something also you're gonna touch on is the difference between the clinicians and then the caregivers' perspective. But then I'm also, if I'm correct in what I've read, is that in dystonia, kids or people that have it, that when they fall asleep, they're just it's non-existent.
Yeah.
Right? So that's tough.
Yeah.
how do you describe? I mean, I remember having a parent interviewing a mom, and she said that when she told the doctor, and the doctor told her, I think your child has dystonia.
Yeah.
And she said to him, like, but he looks so normal, like when he's asleep, like
Yeah.
that, like everything's fine.
Yeah.
It's when he wakes up that.
Yes.
So.
Yeah. So I think what I try to do is, I don't expect a family to come in knowing what it is and to be able to say, yeah, this is this is how dystonia shows up in my kid. I think that's a collaborative conversation that we need to have with each other. So everybody's dystonia looks a little bit different, right? Just like everybody's CP is a little bit different. Mm-hmm. What is that saying? You meet one person with CP, you've met one person with CP. Dystonia is like that too. Okay. So it's a back and forth conversation where I try and understand, some of the movements that I would be looking for that I don't see in this 30-minute block of time. Let me describe those movements to you, or let me ask you when your kid is asleep, like, I see that their legs are really crossed right now. Or do you feel like their legs are really open, or they're loosey-goosey when they're asleep? Families know. They know. Like, people are the best expert on a person's movements is the person with CP and their families and their caregivers. Mm-hmm. They know. They know more than I will, because I see them for 30 minutes every 3 to 6 months. Mm-hmm. Like, they know their movements way better than I ever will. Yeah. So I fully trust that a family can describe what movements look like. Mm-hmm. And then it's my job to say, okay, based on these very detailed descriptions, mm-hmm. these descriptions go along with dystonia, these descriptions go along with other things. Now let's talk about that a little bit further.
Okay. So it's truly a collaborative.
Totally.
Because you don't really get to see them that often.
Yeah.
And I'm sure a lot can get missed.
Yeah.
And now talking about, your educational session and advances in diagnosing it. Is there a role of AI? Is there a role? I mean,
yeah.
What are you seeing happening in terms of where we're going when it comes to diagnosing dystonia?
Yes. So I think in my opinion, there's going to be no one single best answer for how to improve dystonia diagnosis and kind of trying to figure out what its impact is. Like, how is it affecting you? Mm-hmm. AI is one way, definitely we can support that. We've already talked about a couple of other ways. A big one is asking families, what are the movements you see? We cover that in 2 of the talks in this session by Rose Jelena Morale at Kansas City and Laura Gilbert in Chicago, Illinois. Another part of it is asking, just reminding clinicians to please think about dystonia. Just because you didn't see it in the last visit doesn't mean that it's not there. Maybe you missed it. Think about it every visit and come up with the cue to think about it for yourself every single visit. So that's a big part of Rose's talk, Dr. Jelena Morale's talk. And then the last talk is from Dr. Rishabh Bajpai, who's in St. Louis with me. And his talk is looking at AI and machine learning models to say, okay, well, now if you take a video in clinic, and we use a very specific task, a very specific video of people sitting in a chair and doing opening and closing one hand, and then putting that hand down and opening and closing the other hand, and repeating that a few times. What we've shown in our research is that task in particular is very good at looking for dystonia, believe it or not, in the legs. So if you move your hands a lot, alternating, we're looking for dystonia in the legs. Now, why is that? Why is that good for looking at dystonia in the legs? It goes back to what I said when I was talking about the definition of dystonia. It's when you try to move, a part of your body that you did not want to move moves out of your control. So we are looking for, and your legs have no business moving during a hand task when you're seated. So we look at movements in the legs during a seated task where the person with CP is moving their hands, and we can do a certain type of video analysis and train machine learning models to look at those specific leg movements and identify which leg movements are dystonia. Right now, with better accuracy than even I personally achieve during a typical clinic visit alone, during a 30-minute clinic visit. So it's all of these things. It's talking to families. It's reminding, before I leave that room, did I think about dystonia in this room? As a clinician, reminding myself, did I ask the family? Did I think about dystonia? And now that I have this video, can I think through, are there leg movements in the seated task that make me think about dystonia? And maybe I don't have, it's the 30-minute clinic visit, right? Maybe I don't have time to look at that video right after that clinic visit, but I can run it through an aid, a decision-making tool using AI to help me decide if all those things together mean that someone has dystonia or not.
So it's not AI, for example, is not going to be used as a replacement, but rather as an expansion of what is already used in this case.
I think so.
Observation.
Yeah. I think it can be really helpful because time is for all of us, time travel is important, right? Time is a limited commodity. We all have limited time. So I think AI really helps expand time for us a little bit. Maybe I guess I already am time traveling.
There you go. You're going back, and with this conversation, you're going back and forth, my friend. Okay, so this is where I kind of insert myself, and I have, by the way, I have questions. I want to thank all the doctors that sent in their questions for you, and I will touch on those a little bit further on the interview, but. I have a couple questions because obviously I'm a woman with CP. I have spastic diplegia. And looking at one of your previous presentations, you mentioned that up to, I think it was 50 to 70% of people have spastic and dystonia, but they might not know it.
Yeah, that's right.
And then you said something like people with spasticity can develop dystonia.
Yeah.
So I'm like, okay, does that mean that I, 37, have spastic diplegia and have also dystonia and I don't know it? Like, how does that work? What can you, do you have to analyze my movements right here, right now? I mean.
Yeah, I could. Like, we could do a whole, are we going to do an exam?
Sure.
Okay.
So, but to those that are listening, there's no video of this interview, but right now what we're doing, we're in a room and we're going to try it. We're going to see.
Yeah, let's see. Okay, so first thing,
shoes?
yes, I need shoes and socks off. This is so exciting.
Okay. Exhibit A.
Real time assessment.
Okay. Oh my God, I can't believe I'm doing this. This is so exciting.
Okay. So first part of any exam, and true rest is, I'm not going to make you do this, but true rest is lying down, your body fully supported. But I'm not going to make you do that on this hotel carpet.
Okay.
So, but
I mean, I could.
No, it's okay.
If it makes your assessment easier, I'll do it.
No, it's fine.
Okay.
It's fine. But I will say that seeing someone at rest is really important.
Okay.
I've heard from a lot of adults with CP that the best way to trigger their dystonia is to tell them to relax.
Yeah. Right now,
it's like, because the stress is high. The stress is high.
Yes.
So, okay, but so why don't we'll do this together. And this is how a lot of our task videos will start like this. We'll have, both hands on your lap. You're perfect. Okay, and I'm going to take my shoes off too. Okay, both hands are on your lap. Let's take some deep breaths together. Breathe in. Let's do one more. Okay, I'm feeling like that was really therapeutic for me. I feel good. All right. Yeah. So this is a good sort of rest. This is the closest we can get to rest now that I've sort of hyped you up about this exam. So now, if you can you scoot back as far in your chair as you can? And perfect. What we want to try and do is have your feet as little supported on the floor as possible. But this is fine. This is perfectly fine. So when we do these videos in our clinic, we have people's feet dangling. Okay. We have them sitting on a little bit of a higher chair, but you're fine. I don't want you to artificially do that. Okay. That's totally fine. So now let's do our hand open close test together. So why don't we lift this hand up? Perfect. And let's open and close it. And let's do it as fast as you can. Fast, 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 fast. So I'm gonna have you put that hand down. Did you notice anything about your feet when that was happening? And I'm just so curious, what did you notice?
I felt like something was contracting on my right side.
Right side.
On my right leg.
Yeah.
As I was doing it faster.
Yeah.
Like I was oh my God, Bhooma.
Yeah. Yeah. Yeah, so that could very well be dystonia. Do you feel like that was, it looked, I will tell you what I saw, how I as a clinician might describe it. I would say it looked like your toes looked like they flexed a little bit to me, and I could see that your leg, that you were flexing at your knee, that your knee was flexing. So
because the left did not move.
That's right. I saw it on the right as well. Yes,
so
on your right leg.
The right was like reacting to it.
Yeah, yeah. So it's shockingly common to have dystonia, shockingly common. So in really important work that in my opinion, inspired me to keep going in this field from Darcy Failings and James Rice, they in their data, 70 to 80% of people with CP have dystonia, some degree of dystonia. And it's most commonly seen in the legs. But it's very hard, I think, to isolate what is dystonia and what is spasticity, which is, as you said, like a very common form of high tone in CP, because all of the tasks we usually do involve moving the legs. And so we really feel like this task, and we've only done half of it, right, because you've done one hand, but this task really helps us isolate, like, what part of your movements, what part of your tone is dystonia, and what part of it is spasticity. So, yeah, I don't know. How do you feel? Are you finding this out? Yeah. Are you finding this out in real time? Is this?
Yes, no one has ever.
Okay.
I mean, no.
Does that? Is that a weird feeling?
I'm very surprised.
Yeah.
I didn't think I would have it for some reason.
Yeah.
You know, even though I read and I saw your presentation at 70, and I was like, no, I can't have dystonia, you know?
Yeah.
I guess I thought of something very different but this is I can't believe it.
Yeah.
It's not bad or good. It's just, like, how can a doctor not know it? Like, I've been to the doctor, right? But I guess for other reasons, so they never really analyzed me for dystonia.
Yeah. So. I mean, that's why we're doing the session, you know? I think I never planned on doing any of this work. Can I just say? Like, I started out, my plan once I started my research career was to only study mice. I had not planned on doing any clinical research, any work with people or any sort of dystonia diagnosis work. But the more I got into this, I wanted to figure out, you know, what causes dystonia in mouse models to help develop treatments. But I didn't know how to describe dystonia in a mouse because we didn't really have a great way of catching it in people. So that, the product of that realization, I guess, like the result of that is this session. Yeah. With all of my friends and collaborators.
Wow.
Yeah.
And how, I'm just going to say something, and we can, I want to do one more. So
We've only done half.
So we're doing this session. You came for an interview, a podcast interview, you know, and obviously very happy. We're both bright colors.
Yes, we're matching, we're coordinating.
We literally kind of, but well, in my blazer and your beautiful dress. How did that make you feel to see that in your friend and someone that this is totally unexpected? I'm basically putting you in the spot, but to see how someone is reacting to finding out that they have possibly, you know, dystonia, or based on what you've observation so far. I mean, we've only done half, but
I think a part of me gets nervous, I would say. I think it's very difficult to, I want to make sure that it's not, that it doesn't feel like a gotcha moment. I don't want it to feel like that. I feel like when, this isn't the first time this has happened. I think that I work with, as you know, a lot of adults with CP. I collaborate with a lot of adults with CP because I learn a lot from them. They have such great expertise. I feel like I want to make it like a conversation where we're learning about each other, and this is a new thing that I'm learning about you. Mm-hmm. But it's also a new thing you're learning about yourself. So I want to be sensitive. Yeah. So that part makes me a little bit nervous. Okay. I just want to be sensitive to your experience of it. Yeah.
I think this whole interaction, I think it speaks to the importance of a talk that you're having, right?
Yeah.
The session that we're talking about right now, that you will have on Saturday, right? And just the barriers of diagnosis, what to see, what to look for. Wow, it brings in a whole new understanding. So let's do another one.
Yeah, let's do another one. Okay, let's get back into our rest zone together. So some deep breaths. How are you feeling? Good. All right. Now let's do this hand, and let's go slow, open, close, and now let's go fast. Okay. And go ahead and put that hand down. Did you feel anything that time? No. I didn't see anything. Do you have a weaker hand or a stronger hand? Which hand is?
My whole right side is weaker.
Your whole right side is weaker. Okay.
Yeah, I'm a left-handed full-on.
Okay. Let me see one more thing one more time. Can I see you do the left hand one more time? Open, close, fast you can, fast you can. Yeah. Okay. And go ahead and put that down. Did you feel that again on the right side? Okay. I will say that usually what we see for people who are although this is not always a rule, for people that have their leg dystonia triggered, is that the hand that a task that's really hard to do, or the hand that is maybe a little bit weaker, that doing the hand open close with that hand is usually what triggers more dystonia. And this part I haven't, this is just my personal opinion, this part is not published, okay? So disclaimer on this part. Okay. I don't think that's true for people who have hemiplegia. I think it's a little bit different. But either way, I do think that this hand open close task really helps you figure out, is there, the word that we use for it clinically is overflow dystonia. Does your leg move when it has no business moving, when you're moving other parts of your body?
I feel stressed out when I do literally, I feel my muscles contract.
Yeah.
I don't know if I'm supposed to feel that, but.
Yeah, that's.
Wow.
I think I feel pretty confident that's dystonia.
Okay.
Yeah.
I learned something new about myself.
Yeah.
Now you know something more about your friend. She's
Yes.
definitely got dystonia.
Yes.
So now what?
Yeah, great question.
Now what happens to someone who just discovered that they have dystonia?
Well, could be a few different things. We know that a lot of people that a big chunk of people with CP have dystonia. What we're still trying to understand is, does everybody with dystonia, does that dystonia actually impact them in some way? Or is it just there? We still don't know the answer to that question. So when I think about it, and there's a lot of work we're doing to try and figure that out. There's Rose Gelino Morel is helping lead a group in the Cerebral Palsy Research Network in the US and Canada to, step one, increase family awareness of dystonia, because if a family doesn't know what dystonia looks like, then, or a person with CP doesn't know what dystonia looks like, then how do they know if it's impacting them or if it's something else, right? So we had to backtrack a little bit, just like I had to backtrack from the mice, you know? So we had to backtrack and say, like, before, how should I put this? I'm not the person as a physician that should be deciding whether your dystonia impacts you. It's you who should be telling me whether your dystonia impacts you and how.
Yeah, but if you don't know.
But if you don't know, that's right. But if you don't know, how can you tell me? So it's a huge, the huge next push for us is making sure people know, one, that they have dystonia, and two, what their dystonia looks like. And then we can get into the impact question.
Right.
I do my best in clinic to try and do that with families and people with CP that I see. So I'll do very similar to what we just did together. I'll say, okay, let's do this. Do you see what I'm seeing if I'm talking to a caregiver or to the person? Do you feel what I'm seeing? What are you feeling? And then I'll say, you know, that's dystonia. Now there are, and then we'll go back and say, okay, at the beginning of every visit, we talk about, you know, what are you working on? What are some goals or some things that are important to you right now? And it could be something very specific, like I'm working on being able to bring a spoon to my mouth. It could be I'm working on being able to move my power wheelchair better. Or it could be something like I'm working on figuring out how to make more friends, you know? All of those things could be affected by dystonia in some way, or not. So then I'll say, this is what I'm seeing as your dystonia. We've already talked about your goals, things that are important to you, your priorities right now. Do you think that these movements could affect those goals in some way? Or I'll say, like, for example, if I see dystonia in someone's foot and they're saying, like, I'm getting really tired at the end of the day, I'm having trouble walking at the end of the day, I'll say, okay, well, do you feel like you're tripping over your right foot? Do you feel like it's catching on the heel of your left foot? Do you feel like that happens more towards the end of the day? If so, maybe that's dystonia, and maybe we should treat that. So it's these kinds of things that it's a big collaborative discussion. We're trying to figure it out together in real time in the clinic.
Oh my God. All that you just mentioned, at the end of the day, I do get tired, and I do see that my right leg, foot, starts going inward.
Yeah.
I discovered something new.
Yeah.
But I'm so glad we did it.
Yeah.
Right? Yeah, this is going to be a very good podcast episode because in real time people were finding out that I have dystonia and spastic.
Yeah.
And going back to that, actually I wanted to now go into the questions because I know that I only have you for 30 minutes, but I'm abusing your time. I'm so sorry about that. One of the questions that the doctors send, and I'll go into those now after this, is what is the percentage of people with spastic CP and dystonic CP? And how does that impact their life?
Okay. There's an easy answer to that question, and then there's the real answer to that question.
Okay.
So the answer that you'll read in the textbooks and what I learned in training is that about 85% of people with CP have spastic CP, and about 15-ish%, maybe a little bit less, have dystonic CP, dystonia predominant CP, and then there's a much smaller percentage of people that have ataxic CP, which is something we have not talked about. But as I mentioned, the truth is never that clean. So what we know is that most people with CP have both spasticity and dystonia. We also know that it's very difficult for clinicians to really pick what is your main tone. It can be really hard. And there's, between physicians, there's often disagreement on whether someone has mainly, are they mainly spasticity, or are they mainly dystonia? There can be some disagreement there. So what we're pushing for more, and what we're doing in our clinic, is saying, yes, like you can say that this person's, maybe your best assessment today is that this person's main tone, what you're seeing the most of, is spasticity. But they also have hypotonia. They also have low tone in their trunk. They also have dystonia in their feet. They also have some tremor, maybe, in one hand. And so we're very careful to talk about all of those things, because even though you may have, let's say, spastic CP, maybe what's most impacting your ability to reach your goal right now is your low tone. Maybe it's your hypotonia, or maybe it's your dystonia. So that's the real answer. But the textbook answer is the first thing I said.
All right. So 80% have spastic, and then 15% have dystonic.
Yeah.
Is there, because one of the questions that I get from parents is that when they get the diagnosis, they often wonder, like they're given the options, right? The different types of CP. So the ataxic, dyskinetic, spastic, and dystonic? No.
Yeah. So the typical classification is you have spasticity predominant,
Vale.
or you have dyskinetic, and under dyskinetic comes two different categories.
Okay.
One is dystonia, and the other is typically lumped together, chorea-athetosis.
Vale.
But really, those are two different things, chorea and athetosis.
Okay.
And I simplify that a little bit in that most people with CP have, if you have dyskinetic CP, which is the actual title, most likely it's dystonic CP that we're talking about. Most people with dyskinetic CP, it's a dystonia predominance.
Okay.
And even people with chorea or athetosis will, their main tone type, if they have those, most likely they also have dystonia too.
Okay.
And then the rarest form is the ataxic CP. Depending on who you ask, and you're asking me, you can also have hypotonic CP, so CP where low tone is your predominant tone type. And that's very controversial.
Well, that's one of the questions that was sent in for discussion. So
Okay.
I will ask one last question and going back to what parents tell me. Thank you for these 4 types. I forget.
Yes, yeah.
Parents are like, one, what does it mean, right? What is the different types? And then they say, okay, we got what it meant, but is there one that is better than the other?
Yeah, that's a great question. I would say no, and I have mixed feelings on this, I'll say. I think that for me, I think putting someone in a bucket and saying you have spastic CP, you have dystonic CP, I think it makes us in the clinic put blinders on and not look for the other movements or considerations that may be affecting someone, the ability for someone to reach their goals. But I don't necessarily put people in buckets and say you have spastic CP, you have dystonic CP. I say, you have a lot of spasticity, or you have spasticity in these parts of your body, and you have low tone here, and you have dystonia here. Right now, your goal is affected by mainly your spasticity, so let's treat that. Right now, your goal is affected mainly by your dystonia, so let's treat that. And that's how I clinically practice. But I will also say, talking to my friends who are advocates, caregivers, people with CP, there's a lot of maybe a sense of community, or there's a sense of I have a better understanding of what's going on with me if I get to say I'm this type of CP.
Okay.
So I'm trying to incorporate that really important point into how I practice. But if you're asking me as a physician, is there one type that's better? I think the types, in my opinion, I don't think the types are real.
Okay. What do you mean by that? What do you mean that there is no full on just one, that no person has just one type?
I think that's right.
I just found out I have two.
That's right.
All my life that I can remember.
Yeah.
I've always been described as spastic diplegia.
Yeah.
Right. So you're saying that a person can have multiple, regardless. That no person is just one.
Yeah. I
Okay.
mean, like, you know, the doctors never speak in absolutes, right? I'm never going to be like, it's never going to happen. But it's incredibly rare for people to just have one specific tone type in CP or movement condition in CP and not have anything else. And so I feel like to me, I think putting people in those type buckets, it doesn't serve, it makes me personally a worse doctor, because it makes me put blinders on, whether I want to or not, to what else could be going on with that person.
I guess you only focus on seeing certain things because you're like, no, this person only has this diagnosis, so therefore I just should focus on this.
Yeah.
And just missing on other parts.
Yeah, that's a controversial opinion.
Well,
So.
I'm not a doctor, but I share it.
Yeah, great.
So you have my support. So now, my friend, we're going to go to the questions.
Okay.
That were sent to me by doctors, and which I want to thank them for that.
Yeah, thank you.
So they sent them to me in Spanish, and I just translated them into English.
Got it.
This first doctor, Dr. Carolina Toro from Colombia. She's a physiatrist.
Yeah.
And the first question, I think you already answered, but we'll obviously ask it again. What percentage of patients with spastic CP also have dystonia?
Yeah. So in the original paper I talked about, it was something like 70 to 80%.
Mm-hmm.
That varies a little bit depending on the group of people that you look at. Mm-hmm. I would say it's in a range of 50 to 80%.
Okay.
Yeah.
Second question from her is, have any differences in functioning and or quality of life been reported in cases where dystonia is present?
Yes. There's two very good papers. One from, I believe, Elegas Montbalieu's group, and another from Jean-Pierre Lin's group, that have looked at the functional impact the functional impact of having dyskinetic cerebral palsy. I will also say, and those papers I cite all the time, super valuable. It does affect, it very much can affect quality of life and function.
Okay.
Dystonia can be associated with pain. Dystonia is often associated with motor function limitations. The other thing I will say in this is Kirsty Stewart has, with Adrian Harvey, published a really lovely assessment where once you've educated a family about what their dystonia looks like, that they themselves can rate how it affects their function. I am very much looking forward to using this scale. That's called the Dyskinetic Cerebral Palsy Functional Impact Scale.
Okay.
That just came out a couple years ago.
Okay.
I'm very much looking forward to using this scale, but the first step is making sure our families know what their dystonia looks like. So that's where we are right now,
Okay.
making sure that we're making sure that our families know, one, that they have dystonia, or that a person with CP has dystonia, and what that looks like, and then we can use scales like that to get at that question a little bit more.
Okay.
Yeah.
And I'll ask you for the names of the papers that you.
Perfect.
And so I can add them to the show notes
Great.
of the show.
Yeah.
And then the third question coming from Dr. Toro: what treatments have a clinically significant impact on the functioning of people with CP and dystonia?
Yeah.
What treatments have a clinically significant impact on the functioning of people with CP and dystonia? Oh,
Yeah.
That seems like a very
Yeah.
big question.
So I'll say that the data supporting different treatments is pretty slim, actually. There was a good meta-analysis published on this from Emma Bond and Darcy Failings. I'll send you the reference. The treatments that had the best data supporting them were injectables. So for focal dystonia, meaning dystonia just affecting one part of your body or one limb. So that's botulinum toxin, for example. And then the other treatments were deep brain stimulation, which is a neurosurgical treatment, and intrathecal baclofen, and not just intrathecal baclofen in the lower back, but doing the intrathecal baclofen in the neck, so higher up. So it's a different procedure than what most people are used to when they think about a baclofen pump. The thing about deep brain stimulation and a baclofen pump is that there's very limited access to those surgical treatments, and to some degree also to botulinum toxin. If we're thinking about medications, the data on what's functionally useful is like slim to none, which is awful, right? So we have a long way to go to think about what medications specifically targeting dystonia are most useful. What I can say is from personal experience, which is that the best way to treat dystonia is to help manage its triggers. Meaning if someone isn't sleeping well, and if someone has a lot of anxiety, or one or the other, or both, oftentimes those go together, or someone has a lot of pain, treating those things are your best bet of giving someone functional improvement from reducing their dystonia. I will put people who, I talk about this young person all the time. So I have a young person in my clinic who has a lot of social anxiety, gets very stressed out in restaurants, for example, and that's when their dystonia really acts up. And it's very embarrassing for them, and that makes their anxiety even worse. To treat their dystonia, I put them on an anti-anxiety medication. I didn't put them on a tone medication. And that was what was most effective for that person. So to me, that's I think the first primary focus is how do we treat the triggers? How do we treat the sleep, the stress, the pain that can trigger your dystonia?
And that is a very individual type of treatment, you know.
That's right.
Because, and this is, you know, to live is to have emotion.
Yeah.
Right. So we're gonna have emotions, anxiety. So
yeah.
For people who have dystonia, or me included, there's gonna be different emotions that might trigger it, and how are we gonna know? And so everyone is so different. So
yeah.
It seems that it just depends on every individual case.
That's right.
That's it for today. Thank you so much for joining me in another episode of the Cerebral Palsy Answers podcast. And remember, if you have any questions regarding cerebral palsy in Spanish or English, please submit your question to cerebralpalsyanswers@gmail.com or head over to my website, www.azucenagarcia.com, and you can submit your question there. Thank you.